Asthma by Madison Weber and Lauren Gilbert. What is asthma? Asthma is a respiratory condition in which a person's airways become inflamed and produce extra mucus. This mucus and inflammation can make it difficult to breathe. Inflammation makes the bronchi become very tiny and narrow, which causes them to spasm, which then produces an asthma attack. Certain things can trigger more inflammation, like allergies, such as dust or pollen. Symptoms of asthma include wheezing and breathlessness, coughing and chest tightness. These produce asthma attacks. Sensitivity to asthma triggers, such as dust, pollen, or even respiratory infections. These can be especially prevalent at night or early in the morning. Asthma attacks are when the airway shrinks and the patients find it difficult to breathe. These can require hospitalization or inhalers. Everybody can have different triggers. It is even possible to prescribe an inhaler when you have a common cold in order to open the airways more. The diagnosis: there is no cure, but medication will help. The doctor will ask you how long you've been and when you started experiencing your symptoms. They will ask if anyone in your family has been diagnosed with asthma. They will ask you if it is affecting your quality of life, and then they will run pulmonary function tests like spirometry and exhaled nitric oxide. Symptoms can only be managed, and longer than 10 days is a typical amount of time period when they start to consider asthma. Missing school, work, and social events are all part of affecting your quality of life. Spirometry tests strength and volume of lungs, while exhaled nitric oxide, or ENO, is when nitric oxide is produced in the airways to fight inflammation. A high amount is an indicator of asthma. Risk factors. It's fairly common and affects 1 out of every 13 people. If someone in your family has it, you're at a much higher risk. Being exposed to irritants, smoke, dust mites, and mold raises the risk, as well as living somewhere with air pollution. The genetic tendency to develop an allergic disease is called atopy, and being surrounded by bad things weakens the lungs and can cause asthma. Typical respiratory function starts with air flowing into the mouth or nose based on the pressure gradient present. The diaphragm drops to allow more air to flow in. Then it goes to the pharynx, where the epiglottis lifts to allow air into the larynx. Once it's in the larynx, it goes to the trachea, then the bronchioles. Then oxygen saturates the lungs and alveoli, where capillaries of pulmonary circuit send blood back to the heart to be distributed through the body. The pressure gradient resets in O2. Now CO2 is exhaled. The diaphragm pushes up to place more pressure, and the pressure then moves high to low, so air will then exit the lungs. How does asthma affect this function? First defined as paroxysmal dyspnea of a peculiar characteristic with intervals of respiration between attacks. This is translated, in layman's terms, as a sudden violent attack of labored breathing between periods of regular breathing. Bronchospasms, first recognized as a bronchospasm, is the spasming of the bronchioles and bronchi. For many, an allergen trigger is caused when an allergen or irritant enters the respiratory tract and causes a reaction. Narrowing of pathways that takes air from the mouth and nose to the lungs. Bronchoconstriction is during an asthmatic episode, typically begins with a trigger, dust, pollen, etc. This leads to the bronchi of the lungs starting to spasm excessively. These spasms are followed by inflammation. The inflammation causes the airways to narrow, and at this point, excess mucus begins to develop. This inflammation and mucus is what causes the coughing and other breathing difficulties. It can also be affected by T helper cells malfunction. These mutate and activate humoral response. Inhaled allergens are ingested by a type of antigen presenting cell. This APC presents the antigen to helper T cells, which check the antigen to see if it's harmful. In healthy people, their helper T cells ignore the inhaled allergen and do not activate a response. In someone with asthma, these cells transform into a different helper T cell for reasons that aren't well understood yet. These mutated cells are called Th2 cells. These Th2 cells activate the humoral immune system. The immune system then produces antibodies against these allergens, which recruit many eosinophils and mast cells to the lungs. The mast cells and eosinophils produce histamine, which leads to allergic symptoms and smooth muscle spasms, like the throat. There are many medications. Some of the long medications are generally taken daily. They help to keep asthma under control on a day-to-day basis and make it less likely that one will have an asthma attack. Inhaled corticosteroids like the Pulmicort Flexhaler, which uses the drug budesonide, work to decrease inflammation and swelling in the airways by decreasing the body's immune response. However, they can also cause a cough, hoarseness of throat, throat irritation, and even thrush. Thrush is a yeast infection of the mouth. It also raises the risk of cataracts, although not significantly. Leukotriene modifiers such as montelukast inhibit bronchoconstriction due to antigen challenge. Montelukast binds to certain leukotriene receptors in the airways to prevent them from causing inflammation. The leukotriene receptors that they bind to are released from eosinophils and mast cells during an asthmatic episode. However, they have had adverse effects such as flu-like symptoms, anxiety, headache, and even nasal congestion. Salmeterol stimulates adrenic receptors in the airway. The stimulation of these receptors causes bronchodilation, but is also associated with dry mouth, nausea, rapid heart rate, throat irritation, a cough, and anxiety. A combination inhaler like budesonide/formoterol inhaler combines the effects of budesonide and a drug similar to salmeterol in order to reduce inflammation. There's also quick relief or rescue medications. Rescue medications are used on a needed basis for rapid short-term relief during an asthma attack. They are also commonly used before exercise for preventative measures. Short-acting beta blockers, like albuterol, act as bronchodilator. They relax the muscles in the airway, allowing for more air to flow into the lungs. Albuterol acts on the beta receptors in the airway, which are the main receptors in the smooth muscle of the bronchi. Side effects include throat irritation, nausea, anxiety, muscle pain, shaking, and a headache. Ipratropium is a parasympathetic agent which works to relax the contractions of the smooth muscle of the bronchi, also opening up the airway to allow for easy breathing. Side effects include upset stomach, stuffy nose, anxiety, sore throat, and flu-like symptoms. Prednisone has many uses for allergic reactions, but for asthma, it lowers the immune system reaction and reduces swelling of the airway and lowers mucus production, which means the body is less likely to react to asthma triggers. Side effects include weight gain, sleep problems, mood changes, headaches, slow wound healing, acne, and nausea.